AS Biology. Welcome. Are you excited for a fun learning session? Make sure you have your book and a pen before we start. Today you are going to learn about antibodies. Antibodies in medicine. Active immunity occurs where the body makes its own antibodies. Natural active immunity occurs after catching a disease. Artificial active immunity occurs when the body becomes immune after vaccination. During vaccination, the body is injected with a harmless dose of antigen. Passive immunity occurs when antibodies are donated from another organism. Natural passive immunity occurs when a baby becomes immune through antibodies it receives from its mother, often through breast milk. Artificial passive immunity occurs after being injected with the antibodies from another individual. In the case of a tetanus infection, the individual is injected with antibodies that counteract tetanus toxin. These antibodies are collected from blood donations. Monoclonal antibodies can be designed to bind to specific substance in the body that can cause harm or need removal, for example an antigen or a toxin. Monoclonal antibodies can be used to target cancerous cells. Cancer cells contain antigens called tumor markers. These markers are not present in healthy cells and so they can be used to target only the cells that are cancerous. Anti-cancer drugs can be attached to antibodies that are complementary to the tumor markers present in the cancer cells. Using monoclonal antibodies that are specific and complementary to deliver the anti-cancer treatments means that the cancer drugs will not cause widespread damage to healthy cells. This means that there are fewer side effects from the drugs for patients and can lead to better outcomes. Monoclonal antibodies can be used for medical diagnosis by detecting for molecules that are present in the body. For example, pregnancy tests rely on monoclonal antibodies to detect the hormone human chorionic gonadotropin, which is present when women are pregnant. As part of diagnostic testing for the presence of antibodies can be done using an enzyme-linked immunosorbent assay, ELISA. ELISA testing is used for medical diagnosis and it is often used to see if a patient is suffering from a pathogenic infection. ELISA testing can also be used to test for allergies to certain compounds. There are two types of ELISA test: the direct ELISA and the indirect ELISA. In ELISA testing, antibodies are bound to enzymes. These enzymes will react with a substrate to produce a color change. The color change is used to show a positive result. This only happens if the antibody associated with the enzyme binds to an antigen. Direct ELISA involves the use of a single antibody. This antibody will be complementary to the antigen being tested for. The process to run and direct ELISA has several stages. Step 1. Antigens are isolated from a patient's sample. Usually the sample is blood or urine. The antigens then bind to a plastic. Step 2. Monoclonal antibodies attached to an enzyme that are complementary to the antigen are added. This means that if the antigen is present, then antigen to antibody complexes will form. The well is then washed to remove any unbound antibody. Step 3. Then a colored substrate solution is added to the mixture. If the complex is present, then the enzyme will break down the substrate, and the color of the solution will change, showing a positive result. Indirect ELISA uses two antibodies to work and it is often used for HIV testing. Like with a direct ELISA, there are several stages to testing with an indirect ELISA. Step 1. A HIV antigen is attached to a well plate and then the patient's blood serum is added. Step 2 to 1. If there are HIV antibodies are present in the patient's sample, they bind to the antigen. Then the well is washed and this removes any unbonded antigens. Step 3. A second antibody is then added. This antibody has an enzyme attached to it. The secondary antibody binds to the primary HIV antibody. The well is washed again to remove any unbonded antibodies. Step 4. A substrate solution is added. The substrate will react with the enzyme carried by the second antibody. A positive result is shown through a color change. Monoclonal antibodies are often produced using animals. In order to make a monoclonal antibody, mice are injected with an antigen. This causes the mice to create antibodies to counteract this antigen. These antibodies are removed from the mice via surgery. All surgeries have a risk and so this can cause the animals to die and can cause suffering.